So we're also just want to make sure, just for the sake of making this work well for everyone, make sure to mute your phone when you're not speaking. And again, you can do that in the bottom corner. When you bring your mouse down, up will pop a control panel and you can hit mute. Obviously, you can also hit mute on your phone if you so choose. And you can also press *6 to mute and *6 to unmute. Don't put us on hold. Lovely music. It's all nice, but we'll be able to hear it throughout, and that would be that. And if at all possible, don't use your speakerphone, only because that also makes it more difficult for people to hear. And we really, just because of the way this works, as you know, we need to learn from each other. So it's just vital to have you participate and be able to be a part of this as fully, and to move everyone forward. And if you would prefer, you're always welcome to use the chat box, and we'll always have one of whoever is not speaking will be monitoring. And if you're using your phone audio, could you take a minute to make sure that you're linked? So we're going to show you on the next page. Carrie, if you could go to the next slide. So if you joined by computer after calling in via phone, you can enter the participant ID to bind your phone and computer session together. And your participant ID usually pops up on the webinar platform when you go to your name. It will show you what your up at the top of the screen. If you hover over yourself, you'll see your participant ID, and then you can enter that number on your phone, and that will link you up to your actual. I'm trying to see who else I might need to mute to get a little less ambient noise here. All right, very good. That will link you up to your computer. So I think that's all. So you go ahead, Carrie. I'm going to continue to make sure people are muted so we're not getting background noise.
Perfect.
You can go to the next slide.
Okay. So I first wanted to say I hope you all have fared well with the very weird storms that we've been having, and I appreciate those of you that have reached out to us to see how we're doing. It means a lot. As far as I have heard, everyone at our organization has fared very well, and so have their families. So we're incredibly thankful for that, and we're incredibly thankful to you all for caring. So we do appreciate that. Today, we're going to be primarily discussing a tool called a Gemba, or an observation walk. And specifically, we're going to be talking about what a Gemba walk is, how you complete one, and how you can really use the tool to propel your team's work forward by gaining a better understanding of how your patients and your families view your current systems and your processes. And then we're going to have time to discuss as a group what processes your teams may be able to observe, what benefits you hope to gain from doing that observation firsthand, and then also what challenges and concerns you anticipate, so we can talk through those together as a team. And then at the end of the call, we will be wrapping up by providing some next steps about pre-work for the on-site learning collaborative, and also some project updates. So like Bethlyn mentioned, me and Mary will be presenting today. I think you all know us, so I will spare you all our introductions. But here on the screen now, you will see our friend, the Model for Improvement. I hope you all recognize this. We have been using it as a step-by-step roadmap to help us move our projects forward in a structured way. And before we jump into our tool of the day, we did want to take a second to reflect on where we've been, and also reflect on all of the great work that you all have done to get us to this point. And we're hopeful that by reflecting on where we've been, we'll also be able to make a more clear connection that really fits with where you are now, and how it can help, again, move your project forward. So if you guys will remember back to the very beginning of the collaborative, I guess it's been about a year-ish now, we did ask you to start by choosing some focus areas for your teams. And we asked you to do this by using some of those value-driven decision-making questions, and by using your answers to those questions to prioritize those focus areas for your particular state. And then, of course, we asked you to develop a team. And not only did you assemble that team, but you did a lot of work around team building, developing roles and responsibilities, and developing a team structure that really helps facilitate communication within that team. And I do think it's worth mentioning that you're likely not done with this team building. We know a lot of you have added new team members as your project AIM develops, and you really may have had to go back through that forming, storming, norming, and performing stages that we talked about at the on-site, and that's normal. So once you selected your focus areas and you developed your team, we asked you all to develop some specifics around what you hope to accomplish by participating in this collaborative. And you did that through developing an AIM statement and charter. And we're getting a little bit of background noise. I'm not sure where it's coming from, so if you wouldn't mind just muting yourself, that would be great.
I'm doing my best to try to be the muting police, but it would be great if people notice that they're not muted to mute themselves as well. Thank you.
Thanks, Evelyn. So we've also been working as a group to sort of figure out how we can measure so we know that the changes that we're implementing are actually resulting in an improvement. And not only have we had really robust discussion around those common measures and the KETA systems, but I know many of you as state teams have really began to think about those individual measures as well. And I know the measurement piece is sort of a hot topic right now, and we are going to be providing you guys with some more information during the wrap up of today's call about how we plan to keep you all informed about the recent developments that the measurement work group has been working on and how we plan to get your feedback as well. So stay tuned for that. And then most of our teams are currently operating in this ideas bubble as you guys try to figure out what changes you can make that will result in an improvement and have a positive impact on your AIM. And you guys have been doing this in a lot of different ways. So I know at the on-site, we did the force field analysis, the 5 R's. I know a few of you have really used that fishbone diagram to gather input from your different stakeholders. You've been looking at information around those alternative payment models. I know many of you have done a lot of in-depth work around those key informant interviews and those focus groups, and you all have obviously been looking at the literature and the research to see best practices and promising practices and bright spots and all of that great stuff. And I know some of you have been doing observations as well, and the gimbal walks really fit under that observation piece. So that's sort of what we're going to be talking more about today. And then throughout all of this, you guys have been using those small-scale tests of change to continuously modify your approach as you learn more about your unique situations and your unique processes. And your coaches are going to be continuously encouraging you to continue to test on a small scale before you roll some of these things out for implementation. And then, of course, it's always worth mentioning that you guys have done a really great job at keeping your project centered on that family engagement and collaborative sharing. And we're going to continue to do our best to foster those two things by taking advantage of a lot of the resources that we have at the collaborative level. So we have our friends at Family Voices. I know Boston University has been working really hard on getting that shared drive up and running. Our first newsletter went out. And of course, there'll be a lot of collaborative sharing that goes on at the on-site and on the future webinars as well. So thoughts or reflections from you all before we begin to move into the new material. Any questions so far? Okay.
If anyone has questions, you can put them in the chat box, or you're welcome to unmute yourself again. If you go down to the bottom of your screen, a control panel will pop up and you can mute and unmute yourself there.
Perfect. So today we are going to dive a little bit deeper into this ideas bubble because, again, like I mentioned, most of you are at a point where you really are trying to decide what intervention to test. And in order to do that, first, it's important that you understand your current process. And then, of course, you have to use that understanding to identify opportunities for improvement. And then you have to look at those areas that you identified for improvement and try to figure out the root causes of the problems that you're observing. And then you get to move to the fun part of actually identifying those change ideas and solutions before you prioritize them to figure out what intervention specifically you want to test. So this really truly is a multi-step process, like we talked about at the on-site when we dug into some of those root cause analysis tools. And like I mentioned, I do think all of our teams are operating in this ideas bubble in some capacity. But I think it's important to note that you all may be operating at a different place within this bubble, and that's okay, and that's great because we'll get to learn from each other as we move throughout the project. Okay. So like I mentioned, the tool that we're going to be talking about today is a Gemba walk. You may have also heard it called an observation walk. And I'm going to pull up a quick poll now just to get a better idea of your past experiences. So how many of you all have heard of a Gemba walk or an observation walk before? If you could just choose yes or no quickly in the poll, that would be great. I see we've got votes coming in, so I'll give it another second. There's a few more votes coming in, but we're really hovering around that 50-50 mark. So it's going 48-52, 50-50. So we really seem to have a good split here on the. I'm going to ask one more question. So how many of you all have participated in a formal Gemba walk or observation walk, those of you that have heard of this before? So it looks like we're about at the 25% yes and the 75% no. So that's great. So there are some of you on the phone that have that experience. And as we go throughout the webinar today, I invite you all to take yourselves off mute and share your experiences with us. Write tips in the chat box because we want to learn from what you all have done in the past as well. But I'm also excited that some of you haven't done this before. And you all will get the opportunity to do this. And I promise it's fun. Okay, I'm going to exit out of the poll here. So this tool really is a great tool as you guys operate in that ideas bubble because it really does help us better understand our current systems and our processes as they operate right now, as they operate today. And typically during a Gemba walk, what you do is you follow a person or a thing of interest so you can observe the process firsthand and identify what works well and then maybe what's not working so well. For many of you, that means you're going to be following your patients or your families, right? You could also be following a thing, though, depending on your chosen focus area and your aim. So you could be following a discharge plan or a contract, for example. So your coaches are going to be encouraging you all to get creative as you begin to think through what process you're going to observe and how you want to do that. So question for the group, why do you think observing the process firsthand is important? And you can take yourself off mute or you can type in the chat box here. I know some of you have done this before, so I'm hoping there are some benefits that you all experience. So what we think we do is not always what we actually do. You learn things that surprise you in the real environment. Exactly. So sometimes we have perceptions, right? We think we know what's happening, but then when we actually go and we observe, we learn that different things are going on. And sometimes those things are surprising. Anything else? Thank you all for sharing, to Mary and Rhonda there. Often we can't take frontline staff offline to design and revise the processes. This is a method of being more inclusive. I love that, Paul. It's a great way to see how our frontline staff operate and to include them when we're not able to maybe pull them into our team as a core member. And we know that our frontline staff are often the people that know the most about our processes, right? Because they're the ones that are in them every day. So it's so important to get those perspectives. Like Rhonda mentioned, we get multiple perspectives, totally. You know, we have multiple people observing, so we're able to get different perspectives from those observing, but also from those operating in the process. And it's always best to participate in something firsthand. It's rarely what we imagine it to be. Exactly. You guys are hitting on many of the points that we had on our slide here. So again, we said you see how the process is actually performed versus how you think it's performed, like we talked about. You understand the process through the eyes of the patient and the family, because again, oftentimes you're going to be following those individuals. So you get to sort of see what they're seeing, hear what they're hearing, feel what they're feeling. So that's always really important as well. You guys mentioned the different perspectives, and I think you were getting at that system level view as well, right? So oftentimes we operate in silos, and it's hard for us to know what someone else is doing in another part of the process. So by observing, we get to see how the different components connect and where those handoffs occur, which is very valuable as well. So what are the drawbacks to observing the process firsthand? Again, you can type in the chat box there, or you can come off mute. And there are drawbacks. This is one of my favorite tools. I think it's incredibly valuable, but there are issues as well. It can use a large amount of time, definitely. It's incredibly time consuming, right? We have to figure out what process we're going to observe. We have to figure out how we're going to observe it. We have to get our team together at a time that works for everyone. We have to actually go and observe the process firsthand, which takes time because the process takes time. So it's very time consuming. So sometimes people are nervous about being observed, definitely. And that's why it's so important that we communicate why we're observing, right? We want people to know that we're there because we want to help improve the process, not because we're being judgmental. By participating in the process, we may alter what typically happens. Yeah, I don't know if you guys have heard of the Hawthorne effect. People tend to behave differently when they're being watched, but also by us being there, we're inherently introducing a factor that's not normally there, right? And you have to be committed to honoring what you discover. Sometimes that means revisiting the initial hypothesis, totally. Like we talked about and like you all mentioned, sometimes we learn things that are surprising, and sometimes that means that we have to change what we were originally planning on doing based on what we learned. And it might be awkward for families to have others view them. Also, it's still a snapshot. It doesn't expand upon the history, what happened before, what happened after the family goes home. So definitely, we are just getting a snapshot. It helps if you can observe under multiple situations or multiple families, but we're never going to get the full picture, right? So it's important that we recognize that and that we supplement our observations with the other forms of data that we have available. And Mary mentioned that, you know, the respect for people piece. It's incredibly important that we realize that we have to respect our staff and our patients and our families as we're doing this observation. And then Carolyn mentioned here, this is an opportunity to build the team by providing an opportunity to learn how the systems really work from the family perspective, but also the family team members are able to learn about what is happening behind the scenes that they are not aware of. So it puts everyone on the team at the same understanding. Absolutely, it really helps get our team on the same page, right? Again, we all come from different backgrounds. We all work in different areas. So by observing the process as a whole and by observing the process together, we're able to get a more complete understanding of how that process works. And we're able to do some team building and really ensure that everyone on our team is the same page as well. So fantastic feedback, guys. I really appreciate you all sharing. We hit on all of the points that we have up on our PowerPoint here. Like Mary mentioned, you all are a very smart group. We knew that and we appreciate that. So this slide really shows you how to complete a Gemba walk. First, of course, you have to decide what process you want to observe, right? You have to decide where you'll start observing and where you'll stop observing. So you have to set those boundaries for your observations. You're also going to need to think through how you will observe the process real time. And we know that that's hard, and we know that that may not be possible for all of you, especially if you're dealing with very rare occurrences or if you're dealing with a very fragmented process, and we know many of you guys are. And we're going to talk through some alternatives and some creative ways to observe, even if you're not able to observe real time. And then, of course, you need to think through who you need to get permission from. I think this really goes back to the respect for people that you all were mentioning in the chat box. We need to make sure we let people know what we're doing and why we're doing it, and we need to make sure they're okay with us actually being there to observe. And we need to make sure that they're able to help us figure out the logistic piece as well, of course. And so once you determine what process you're going to observe, you actually have to go and assemble your team. And we do encourage you all to really put some thought into who you want to be a part of that observation. We typically say the more members from your team that you can have present that's within the realm of feasibility, right, is better, because again, you get those different perspectives and it does sort of help get everyone on the same page. And it really is so valuable to see it firsthand. So do make sure you're talking as a team to think who should be present during that Gemba walk. A lot of times it's helpful to have someone that's familiar with the process be present as well, so they can help explain some things to you after the fact if there are portions of the process that maybe you had questions about. I'm seeing we have something in the chat box here, so I just want to take a second to read that. So Rhonda asked, what does Gemba mean and where does the word originate from? So that's a great question. It means where the work is done. So it's actually just saying, we're observing the work as it happens in its real place. It originates from the lean philosophy. It's a Japanese word. So that's why we hear some of those really funny words, because they do originate from that Japanese background. And then once you have your process chosen and you've got your team developed, you actually get to go to the Gemba, right? You get to do the fun part. You get to go and follow that person or that thing that you identified as the center of your walk. So if you're looking at the process for transitioning a patient from hospital to home, for example, you may want to follow the patient. You may want to follow the discharge coordinator and observe that process. If you're looking at transitioning from pediatric to adult care and you're interested in a specific visit where a lot of that information exchange happens, you may want to see if you can follow a few patients during that visit to get that real-time observation. And while you're observing, we want you guys to document what you're seeing, right? And we're going to provide you with a form on the next screen that can help you document those observations. So specifically, we want you to list out each process step and what you see happening during those process steps. We also want you to make sure you're jotting down any data that you see, and we're going to provide some examples of what that data may look like here in a second as well. And then, of course, we want you to note any areas for improvement, as well as any ideas to help make those improvements that may come to you as you're doing this real-time observation. So here are some examples of data that you may want to collect. So of course, there's the frequency piece. You're going to want to think through how often each process step occurs and when it occurs. You're going to want to look at cycle time, so thinking through how long it takes to complete each process step. You're going to want to take note of any wait times that you observe. You're going to want to jot down what the staffing models of each process step look like, specifically paying attention to where handoffs occur, because we all know, especially in healthcare, when there's handoffs, sometimes that provides us with an opportunity for increased errors. You're going to want to note any error rates that you see when you see mistakes happening. And Mary and I actually were talking earlier today about what a mistake means. And I think that's a really great conversation that you all may need to have within your team as well. So you may need to operationalize what error and mistake means for your team, especially if there are some people on your team that aren't necessarily used to seeing the process firsthand. We also encourage you guys to jot down any gaps that you see between the current standard of care and the evidence-based standard of care. And of course, if you hear any qualitative comments from your staff and your customers, really powerful to write those down as well. So any questions about the types of data that you may want to be collecting, or any tips from those of you that have done this before. I do think it's really important to realize that you may not be able to collect all of this data real time as you observe, but we do want to collect what we can, right? And then we can use some of those other data sources like the results from our surveys or our focus groups, or by looking at our EHR to really fill in some of those gaps if we need to. So here is the data collection form that I mentioned. Meg very graciously uploaded this to the very top of the chat box. If you want to go ahead and download it, we'll also be sending it out to you as a part of the follow-up to this webinar. So you will have a copy of this. It is electronic, but you can print it as well if that's easier. We encourage you to distribute a copy of this form to everyone on your team. And we encourage you guys to take notes as you observe at the individual level, because different people are going to see different things, right? And it's really interesting after your Gemba walk to get together as a team and sort of talk through what different people saw. But basically the way this form works is you will write each process step in its own row. And then for each process step, you will jot down specifically what activities occur during that step, where you see delays and waits, how long that process step took, what weight you observe, and then also what improvement ideas you have as you observe. So you'll see on the screen here, this is an example that is based on a team that was looking at transitioning from hospital to home. So they decided to observe from the willingness to return home assessment to when the follow-up visit was scheduled. And so you can see for that assessment process step, they made some notes about what happens. They said the coordinator reviews potential discharge criteria. The families asked about their ability to meet the criteria, their comfort level, and the desired timing of transition. They noted that they saw a 10-minute wait because they had to pause for writer rounding, that the total process time was 30 minutes, and that they did see some waste around having to repeat part of the conversation. And then of course they had some improvement ideas around scripting and setting up a time beforehand to ensure that all the family members were able to be present. So I see a couple of questions in the chat box here that I want to make sure we address. So the form is located for download at the top of the chat chain. Again, we will also be sending it out to you all as follow-up to this webinar. And then I see another question here. I'm trying to scroll to it. And what guidelines should people use to assemble their team? Would it make sense, for instance, to include family reps since family-oriented outcomes are so prominent in this CoIIN? Yes, definitely. I think including your family reps is incredibly important because they're going to provide a different perspective that we may not otherwise get. So I think that's one person that you would definitely want involved in the actual observation. Like we mentioned, it's also helpful to have someone who's familiar with the process so they can help answer any questions after the observation. It's also really nice to have someone that's completely not familiar with the process because they'll be able to ask a lot of those questions like, why do we do this? Is it necessary? But I would encourage you guys to really have some discussion with your team around who you think would be beneficial to observe, and then come to your coaches with any questions as well. And Mary, I don't know if you have anything to add to that as far as team assembly goes.
Hello, everybody.
Hello, everybody. Oh, well, it sounds like we're having a little bit of echo there. I know Mary will let us know her thoughts in the chat box on that she's not able to speak right now.
So, Mary, just to be clear, if you, if you have if you're on the phone and you have computer, then you'll get an echo.
Thanks, Evelyn. Okay, so before we turn it over to you all, we're going to talk some about what processes you think you might want to observe as your team. I do quickly just want to talk about value, because when you're doing your observations, it's really important that we're always looking for value in ways from the eyes of our patients and our families. And all process steps that we observe can really be put into one of three categories. And those categories are value added, non-value added but necessary, and non-value added. So value added process steps are those parts of the process that our families and our patients really care about, right? It's what the patient is quote unquote willing to pay for. The non-value added but necessary process steps are parts of the process that the patient may not necessarily care about, right? The families may not necessarily care about, but from a business perspective, we have to do them. So typically these things are sort of centered around regulations and laws and all of that great stuff. And then the non-value added parts of the process are those parts of the process that the patient and the families don't care about, and we don't have to be doing from a business perspective. So when we're observing our processes, try to keep that lens so we can be thinking through how we can spend more time doing value-added activities and less time doing non-value-added activities. When we talk about value, I always like to give the example of a sick visit, because I think everyone can relate to this, right? You're sick, you go to your general practitioner or wherever it is that you go, you show up, you either pay for your service if you don't have insurance, they make a copy of your insurance card and you pay your copay if you do have insurance, and then you go to the waiting room and you wait, and eventually the nurse or the medical assistant comes and brings you back, they weigh you, they take your vitals, they ask you some questions, you go to the exam room, you wait for the provider to come in, they ask you some of the same questions, you get the service you're there for, and then you go through the checkout process. So when you're at the doctor's office for a sick visit, what part of the process is the value added part to the customer? We're getting a little bit of an echo again, but if you guys could just type in the chat box if you have thoughts around that. Again, the question was, what part is the value added part of that sick visit? Seeing the provider, absolutely, right? That's what we're there for. We're there to see the provider, get diagnosed, and hopefully get treated, right? What might be an example of non-value added but necessary? Paying the copay, right? Like, I might not care about that as a patient. Actually, I'd probably rather not do it, but it's something that has to get done, right? So maybe the copying of the insurance card, all of that as well would be an example of that. What about non-value added? What's an example of non-value added? And I also see registration for the non-value added but necessary, definitely. Waiting in multiple places, duplicating the why are you here questions, right? Those are those non-value added activities that we may not have to be doing from the business perspective, and the patient definitely doesn't care about. So those are the things that we may be able to eliminate from our process. Some people say, when we ask this question in person, there's always someone that says the wait is the non-value added part of the visit, right? I'm already sick. We don't need to add additional injury to what we're already doing here. There's some fun answers that we've gotten as well. I also see completing some info and registration. So maybe we're collecting things that we don't need. And again, answering those questions more than once, definitely. You guys totally grasp this concept. And then another great way to identify waste is to think through if you're seeing a lack of efficiency or a lack of effectiveness anywhere. When we talk about effectiveness in a process, we're looking to see if we're doing the right things, right? Typically, we're answering the question, is your process in line with evidence-based practices? And then when we're looking at the efficiency of the process, we're answering the question, are we completing the process in the quickest, most cost-effective way possible? And when we're looking at efficiency, there are certain things that we can be looking for, and you can remember those things by using the acronym downtime. It stands for defect, overproduction, waiting, non-value added processing, transportation, inventory, motion, and employee underutilization. I'm not going to go into detail about what each of these things means right now, but there is a handout available for download at the top of that chat box right by where the data collection form was that clearly defines what each type of waste means, and it provides some examples of what that may look like as well. So we do encourage you guys to review that handout and come to your coach with any questions. We'll also be sending that out as follow-up to this webinar as well. But the take home here is that when we're observing our process, we want to be thinking through where we see waste so we can better identify which parts of the process, again, are those value-added components and which parts are those non-value-added components through the eyes of our patients and our families. And we want to be jotting these down so we can get together as a team and think through how we can reduce those non-value-added portions. So any questions so far before we move into the discussion part of this call? Okay. Well, I'm going to turn it over to Mary, and I just wanted to thank you all for being so involved in the chat box there. We appreciate that.
Okay,
Mary,
can everybody hear me? Can everybody hear me?
I can hear you great, Mary.
Oh, lovely. Let me see if I can get my video. So now, can you see me?
I see you.
You see me?
I do.
Okay. Okay, well, I don't see
Beautiful
myself.
as always.
So, yeah, well, I can't see myself, so we'll see about that. Hello, everybody. Good afternoon. Good morning. It's good to hear from everybody. And, oh, I hear thank you, Sharon, for saying you see me. Okay. Hopefully my hair is neat. We're talking about the Gemba and going to the Gemba. And I dare say that most of you have already been observing processes for your project. I know that I've talked with many of you and you're, saying, well, we're looking at this, we're looking at that. So think back just for a moment, though. A lot of times I like to jump out of our clinical hats and move into real world and think of things that you have observed. I was telling, Carrie said that we talked earlier today and we were going through this, and I said, I tend to look at a lot of things now through a different lens, and I'm observing the things around me, and that's just from doing this work for the examples that I put up here. So thinking about your observations every day. But what about these? Waiting in line for food at a ball game. Now, who's done that? Probably a lot of us have done that before. Checking in at your medical practice for your yearly exam. Okay. How about a car wash? One of those automatic car washes. Getting a check cashed at a bank, signing up for a health fair. So let's talk about this for a minute, and hopefully some of you will raise your hand and want to speak about this, and some of the things that you've observed. So what are we as customers looking at when it comes time to wait in line for food at a ball game? Well, we're usually in a time crunch because we have to get back to our seats, before the break is over. We're also looking at the variety of things that we can choose to eat. We may be fiddling with our wallets, trying to figure out if we're going to pay cash or credit card. We're watching the volunteers behind, because they're all parent volunteers, running behind the counter, trying to get everybody's orders. We're looking at the people waiting in line, what kind of people. So all this stuff's going on. But time is of an essence usually. And so time was one of those things, and waiting was one of those wastes that we looked at in that last downtime slide. So oftentimes time. And then what about the car wash? I like to go through those car washes, the nice ones that have the young people, helping you through the car wash and they dry it off and everything. But is it the same everywhere you go? So when I hear car wash and I think automatic car wash, I usually have an expectation of what I'm going to get in that observation. I have my lens on, But you might be with me that day and we might choose a car wash and it may be something totally different for you. You're like, well, why don't you do it yourself? Why don't you go through one of those where you just do it yourself? And I'm like, well, why is that advantageous? And we'll talk about that, the different techniques that are used for doing it yourself versus going through one of those. We have them here in Charlotte, North Carolina. They're called Auto Bill, and you just kind of zoom right through it and they make your car look beautiful. I'd rather do that than do it myself. So the reason why I bring this up is for your Gembas, Carrie mentioned having a good representation of people observing, because we all do have those different lenses. We all look at things differently. We have biases. We come with them. So this helps kind of flush those out. But let me hear from you. What are some of the things that you observe? You could take one of these examples, or give me one that in your own clinical or administrator or personal example of your observing and what stood out to you. Maybe you saw something new, quote unquote, for the first time of a process you've done all along. Anyone dare want to say? I will tell you, I wanted to share this quickly. I watched a video. We're talking about Gembas and observations, and the guy was shooting a video of a fence to a building. And he said, just look at this fence. He walked up to it. Normally you drive up to it, but he was walking up to it. And he said, what do you see on this fence? And to me, it just looked like a fence, and it had a sign on it, like do not enter and that kind of thing. But it looked like looked like an ordinary fence that you would see to gain access to a work building. But then he started pointing out obvious waste. And it was like the sign was printed on both sides, which it really didn't need to be on the interior side, just the external side. It could have been posted somewhere else. So he was picking out all these things where it was a lot of expensive waste. I did not see that when I first saw the video, and by the end of the video, I was like, wow, how often do we just look at things from, whatever standpoint, but miss the waste and the inefficiency. That's why we need each other. That's why we need this data collection tool to help us pick out the parts where we could do things more efficiently or better. And that's why, we do say having your families involved, your parents involved, because they will definitely give you another perspective that we don't have. So Tamara said on here, new technology to make things easier does not necessarily do so. If I don't know the technology, yes. Well, obviously I was kind of like that with this today. Apple Pay, right. Yeah, I know that same thing. I haven't quite gotten that down pat either. So you're right about that. Technology doesn't always make things easier. And so we have to kind of go with the flow sometimes with that. But then that makes what's waste for one person may not be waste for another. So those are some of those discussions that you have as a team. Anybody else want to speak to this? Okay, registration kiosks have a long time. It slows down. Yeah, and that was a good change idea several years ago when medical practices were looking at ways to speed up registering clients or patients. And, and it really made sense. They're like, well, if we have people, they can just go up to the kiosk and do all that work. Then we don't have to, have someone handing out papers and stuff. And then it got to be, like in your example, that it really, people were waiting in line when they could have had a clipboard and filled it out sitting in their chair. And then some went to, well, we'll just put everything online and they can print them off and do them at home. But we know that not everybody's going to have access to that or want to do that ahead of time. So that's true. So that's why we have to do a lot of PDSAs when we're testing things, but, testing new change ideas and not just implementing, because then you find out these efficiencies afterwards. Anybody else? Okay, well, let's go. We're going to watch a video, hopefully, and I want you just to make some observations, okay? You're going to be looking for it's a selective attention. Don't start it quite yet, just up here. You're going to be watching basketball passing. Now, if you've seen this before, please don't comment on it. But you're going to count how many times the basketball is passed. It's going to give you directions on the screen. Just follow along with the directions, and we'll talk about it afterwards. Okay, you can put it on.
Are you ready, Mary?
Yeah, I'm ready. A little slow. Should make it easy to count. Okay, so how many, write down what you got there. Did anybody get anything different than 15? Oh, but did you see the gorilla? Mary got 14. That seems to be a common one. But did you see a gorilla? All right, let's watch it again. Oh, somebody got 16. Okay. Let's keep watching. Oh, they're going to show it, slow down and show the gorilla, because I know there's probably a few of you out there that didn't see the gorilla, or maybe didn't see him do his chest, pound his chest. So there's a bunch of different videos on this cognitive psychology, and why we show this is a couple reasons. One, it's fun, and I'm always amazed. I've been showing this video in classes for a long time, and one thing I'm always amazed at, there's always probably 20%, maybe sometimes even up to 40% of the audience will not see the gorilla even after 2 or 3 times. So what that means is that they say that saying, you can't see the forest for the trees. Also, we can get too stuck on counting and the numbers that we don't see everything else around us. We miss out on that qualitative data that's so important. And then also, too, we just get so zoned into doing what we have to do that we don't see the things around us. We don't have that extra pair of glasses that we need, which that's why the Gemba and having a great team in front of us and around us helps us to get there where we need to go. Any more comments about that? How many of y'all are you honest enough to tell me that you never saw the gorilla? I can't see your hands, because I would really ask people to see it again and see if they saw it at that time. But it looks like a few of you definitely saw the gorilla. So this is a fun video. Maybe your team out there would just like something to do, and you want to stress the importance of having a good balance of qualitative and quantitative data, and you will definitely get that in your Gemba the way you set it up. It may be something that you're totally quiet and you're just observing, or it could be part of it you're listening for words, you're listening for what people say.
And I have to say, Mary, I see some comments here in the chat box, and I have to say I was one of those people. I didn't see the gorilla the first time, and I counted the wrong number of passes. So,
yeah, it's a great thing. It's there's a lot of, like I said, a lot of other videos for selective viewing, and it's amazing what you can and can't see sometimes. So the moral of the story is take into effect what other people see, have discussions about that, and don't just rely on the hard facts, those numbers. Take in that qualitative data. Okay, what's our next slide? Okay, so there might be something that comes up and you say, but we can't see this in real time. So what do we do? So these are just some tips for that. So you do need to ask, can I see some of the process? Maybe I can't see the complete chain of events, but is there a portion of it that we could observe that would be helpful? Maybe half the team could observe one part, and then some other people could observe another part, and then you could come together. Simulating the process, we have to do that a lot of times with PDSA cycles as well. We may have a rare event or something that, just we can't wait around for the next occurrence to happen. We can't wait for the next ride share not to show up for our clients to take them to their doctor's appointment. So we would need to simulate that, and there's nothing wrong with that. You just have to, you know, act out your players, figure out who's the patient, who's the family member, who's the clinician, and you can certainly do that. Focus groups, key stakeholder interviews to fill in the gaps. So there's also data that way too. Maybe we needed that qualitative data we couldn't get with observation, and we need to reach out to this group. What about a home visit? I know that several of you probably do make home visits, and what would we want to learn there? We don't go just to go, but there's probably a direct process, maybe getting the child ready to get for a doctor's appointment. Maybe we need to see that and interview the family and see what's entailed. What about following a family for a day? I like this idea. It's called an empathy tour. And if we're totally, you know, we're not living in this family's shoes. So maybe starting at their home and watching how they prepare for the doctor's appointment, what their transportation looks like or doesn't look like. How long does it take to get ready? Well, thank you, people, for saying you didn't see those gorillas. Thank you. Helped you observe otherwise unknown barriers. I wouldn't know what it's like to you know, put my child in a wheelchair, get all the equipment that's necessary ready, and trying to figure out how much time I need. Then if I had to wait for special transportation, what that entails, and making the appointment and getting there, and then parking in the parking deck and trying to find, you know, a drop-off spot and everything. I might think it's a relatively easy process, but then I really see it and find out it's not. And we're looking again for waste and inefficiencies and anything that we could test or do to make that a better outcome for them. So comments. Are you starting to consider that maybe you have been doing some Gemba and you didn't realize it? What do you think? To any of my family members out there, my family team members on the call, what are some processes that you think would be beneficial for the teams to observe with your point of view and your lens? You can speak out or type, because I'd be interested in that. Those of you that are going to be doing work in clinicians' offices, that'll be important to do some observing there as well, especially if you're going to be putting new roles in those offices, like a care coordinator or something like that. You're going to want to observe their current processes for those who are making phone calls or doing any kind of case management or referral management, and having a view like, where would this person sit? How would that day look like for that person? Is there a place for that person to meet with the family members? Where would we do care conferences? So a lot of that observation. Yes, clinic visit from start to finish. What does that look like? So as Deborah said,
Mary, there were a few other things in the chat too. We have family members in our.
That right.
Yeah, there you go.
Thank you. Okay. Family mentors, our LIM program frequently report their favorite part is when the clinicians attend appointments with them. Yes, yes. Now, I'm not very familiar with what the LIND program is, but it must be something that clinicians maybe don't routinely attend. So you might have to help me with that. But yeah, and I would assume if it wasn't something that I was familiar with, it sounds like you having them there is very important. So it's an overall look at your child's care or a child's care. I think you should see definitely, Jennifer saying, it should definitely see more than just the clinic appointments. Ooh, this thing's moving so fast. Let's see. Okay, Sherry Santa, with our medical education program, we do a 2-hour home visit where a healthcare provider can spend time with the family in their home. Oh, that's wonderful. Program is in many states through the F2F, family to family, I think. Yes, the barriers. If your project is addressing barriers of the client, of the family, of the child, of the clinician, you need to really be out there and looking at it. But you need to ask everyone, what is a barrier? What does that mean? My idea of a barrier may be different, especially if we don't live in each other's world. So having those frank, open discussions about what a barrier is and what that barrier does to you or to them. Is it realistic, Deborah's asking, is it realistic to complete a cycle efficiently without doing Gemba? I'm not quite sure unless you're talking about doing a PDSA cycle. You definitely can do PDSA cycles without a Gemba. Deborah, can you speak a little bit more about your question, or can you get off mute and fill me in on that one?
And Mary, she did type here that she meant she thinks it's essential to have a hands-on family perspective throughout every project.
Oh, okay. Yes, for sure. Definitely. Oh, okay. Yeah. Mm-hmm.
Yeah. And I'll just add, I think it's so valuable, like you all are saying, to really be able to follow a family through an appointment or at home, because you're able to really sort of see what they're thinking and feeling and hear them and kind of experience those frustration points and those enabling factors with them as well. We were working on another project, and there was a team that was looking at food access, and they actually followed a family from their home to the grocery store. And, they didn't realize they had to take 3 buses, and they were only allowed to have 2 bags per person on the bus on the way home. And they had talked to the family about these things beforehand, but it wasn't something that came up in conversation, because I think to this family that was normal, right? So it's not something that they thought that they necessarily needed to share. So there's just so much value in being able to see and meet our families in their own environment and see what that looks like.
Yeah, that's a great point. Just the point you made, Carrie, about the family didn't think that was important to bring up because it was their norm. So, wow. So keeping a spirit of being inquisitive and questioning and trying to find out, each of you have different, again, we say this lens and viewpoint, but that's what it is. But maybe I'm not asking the right questions, too, to get the data that I need. So think about, what kind of questions are we asking? Tamara said that we should remember that the gift every time a family allows observer to what is already a stressful activity going to a provider. Yes, definitely. It's an honor to do that. I did home health nursing for a long time, and I always felt like it was an honor to be even invited into the home and to be part of their life for that moment. And, and that's, again, on those lean principles of respect of people, respecting everybody where they are at that time. We may not understand it at this point. We need to get more information, but that's okay, because that's what we're trying to get at. And oftentimes nobody has ever maybe asked them that question about how many bags can you take on the bus? Are you able to get enough food home with you since you're taking a bus? We never thought to ask, and no one ever bothered to ask them. So that can be a gift as well for the family. So thank you for asking that. All right, good discussions. I hope that you all are thinking about what can we do? What can we do to observe that's within our process? Okay, so what have you already completed? I hope that you're thinking, yeah, I think that was an observation. I didn't put the name Gemba to it, but we certainly watched that. Or better yet, what are you going to observe? You may not have a complete date yet in your mind of when you would do it, but I hope that you're already busily writing down what observations you would like to make. So how do you think this is helpful? How can this be helpful to you? We brought up a lot of points about the Gemba and how we think it's helpful and how it's been demonstrated to be helpful, but what about your team specifically? Please write something in the chat box and identify your state team and say how you think this can help you can take a moment to think about that, but really, you know, for you to have the will and the ideas and the execution that quality improvement takes, you need to think about that. How will this help us now? So take a moment and then please put in your comments in the chat box. And if you already have an idea of what your observation is going to be, go ahead and please put that in. Ah, thank you, Mary. Recenter us in our focus on our values. Yes. Yeah, why are we doing this anyway? Ah, I see. Just take another minute or so to think about how this can help your team now, and what's a possible process to observe. What are we thinking about? What's on the top of your mind? You know, I'm not making you commit to it right this second, but what comes to mind as being something that you will want to observe as soon as you can? Thank you, Minnesota. And Mary was from Indiana. Believing it's essential to have qualitative data to inform whatever we collect quantitatively. Yes. Comprehensive picture is possible to help the families. Thank you, Debbie. And we certainly can ask, can't we? You know, a lot of times we don't know what to ask. So we need help with that with each other too. And, you know, after we have all 10 teams doing observations and sharing information, then you may get some questions to ask from each other. You know, wow, I didn't think about asking that in this situation. So this is the, you know, that's the true benefit of a collaborative, is getting that information, not recreating wheels when we don't have to, and getting different perspectives. Is anybody willing to throw their hat in and say, I believe this is what we want to observe before the on-site? Because we really are challenging you to think of something that you can observe before our on-site, which is about a little over a month. Rahel says, and I believe Rahel is my Texas friend, get a full understanding of how individuals do their part of the process and why. Yes. Because can we do that all the time? No, I don't do everybody's job. I don't want to. So I have to get a better understanding and watch that. And ask questions, pointed questions, and considerate questions. I'll give you another 2 minutes. Go ahead.
I was going to say, if there's something that you would like to observe and you're not quite sure how to observe it, bring that up too, and we can talk through that together as a group. We've got a lot of knowledgeable people on the phone between all our state teams, so we might be able to help you figure that out.
Oh, yeah. Yeah. I was just throwing out the challenge. If people might already know what to do. But definitely, you know, we all have our October coach calls coming up. Some of you may still have a September call in the next week or so. If you want to have those discussions with your coach, that's a good idea. Yeah, but you need to meet with each other. You might not be sitting with your team right now, and you need to, you know, have that discussion. That's certainly understandable. Okay. Well, just pay, oh, wait, wow, there you go. Okay, this is a good point here from Allison in Oregon. And, you know, like we might not have something, an idea, like we can't observe a transition visit because one of the challenges is parents' ability to find a provider. Yeah. We're collecting data from parents, and they talk about how it's a full-time job being on the phone and trying to find the right provider. So we could sit in the room while parents on the phone, but a lot of personal information could come out. Well, that's certainly true. So this might be a good time for just the family interview, you know, interviewing and getting a little bit better idea. You might want to collect some time information. I'm not saying that you could cure that, but you might be able to get a better idea. It's like, okay, the average phone call for finding a provider is 30 minutes. You know, wow, do we want to try to have a goal around preventing that? Or how many times did it take to get to yes? There's all different questions you could ask. You could certainly simulate what it would be like to have a transition visit before it happens, the kind of prep work that you're doing with families to get them prepared for that transition, probably starting around age 14 or 13. You know, how we start, you know, preparing families to going over into adult care. You may want to simulate what it would be like, what it would look like as that first visit going from pediatrics to adult. So, you know, it may require some simulation, but I think you could pick a piece of that, maybe an interview or a simulation. For health ed, we would follow a family for a preventative visit from arrival through visit, observing the check-in, observing for check-in, time and room, repetitions. Yes. Great, that's wonderful. And as far as the sensitivity, I usually look at it this way. I've had discussions with my group, my family rep. You know, family reps may tell you, well, you know, that would probably not be a call you'd want to be on. Or you could say, would you mind? Is it going to bother you? You know, you might have some sensitive questions. Would it bother you that I'm going to be watching and listening and recording how long you're going to be on the phone? So you're going to have those discussions ahead of time. So hopefully you can prevent any awkwardness or if someone feeling funny or not saying something. And could someone pose as a family member to call practices and see for themselves? I'm not going to say you can't do that. You know, that's kind of, oh, that was from Bethlehem. Okay. Well, Bethlehem, you do that. But it might be kind of fun, you know, interesting. That might be the only way to do it if we don't have any other way to do that. And, you know, if we don't have anybody who could ask, what kind of questions would you ask when trying to find a provider? That'd be a good interview too. Maybe we need to test some scripting. So when we're calling, trying to find a provider, we have families an option of scripts that may help them get to yes a little quicker. You know, and what kind of searching are they doing? Is there any way we could improve their searching and how their abilities, what search engines are using, or does it always have to fall upon them? What is the provider doing on their side? Is everybody clear about that? Michelle saying posing would be less helpful because you might get some helpful information, but it wouldn't be weighted as to the impact on the families who have to navigate it every day. Yeah, that's so darn true. So it really depends on your project and what you're wanting to find out, and you know, the pluses and the minuses of your PDSAs are usually warranted. You know, maybe one of the predictions on Bethlehem's PDSA opposing, she'll call one provider and see how that goes. Maybe she wants to collect how long I'm on hold, or you know, maybe her PDSA, her prediction is, I think I'm going to be able to find one, but I bet it's going to be 6 months before I can get an appointment. So she'll test that observance. It wouldn't be necessarily calling as many as a family would have to do. Pretty good discussion here. Okay, well, I know we're getting kind of low on time, so I want to move forward because we got a lot of stuff left to talk about. But still feel free to put your comments in the chat. It's very helpful. I just put some examples here if you're thinking, what in the world do we observe? Well, these are some examples that you may find helpful in your project. You may not. It's just kind of like a change idea. It's like giving you kind of spurring your creativity bubble above your head of possible things that you could observe. So you can read through those. And, you know, you may think of some other ones and go ahead and put those in there, some things that you think would be really helpful. And what I get from you and learn from your observations, I can probably add to this slide later. So that'll be very helpful for me. These are just ones that I've done from past experiences. Okay, well, you know, we have to give you an assignment because we do have a very large, smart group, and you're ready, I know, all ready for the challenge. So, to decide on your process that you're going to observe, and then what's the start and the end, because that could be different You know, you may not be able to start it and end it when you want to, but you might be able to do it, you know, in the middle. So you have a start. You always have a start and an end, even if it's not at the beginning. Reach out to us, the coaches, if you have questions about it. Decide how you will observe it. Can you do it firsthand, or do you need to simulate it? Schedule a time to go to the Gemba, you know, and then sharing with your staff who will be observing, because you don't want to just show up with a clipboard and then people are like, whoa, what's going on, you know. So have an opportunity to share that information. And people do say, well, what about the Hawthorne effect? You may get some of that, but oftentimes you still are getting enough data from your observation to avoid that. Bethlen did want to comment that indeed the critical elements would not be captured, but it would provide a good sense of an overall issue in the real world if you can actually observe. That's true. That's true. Maybe that's what's needed. Somebody else needs to call and see it for themselves. Okay, so your assignment is to decide on something, and then you observe as a team. You can go forward, Carrie. And take notes as individuals. So each of you are going to need to, Carrie said, to make sure everybody gets the data collection tool. Stay focused on what it likes today, what it looks like today, not what you would love it to see. Now, process mapping, you know, we talked about that. You can do a future state map, but for right now, this is to look at it as today. Don't correct them. Don't say, oh, no, you're not supposed to do that. You know, bite your tongue. You're not supposed to. Keep observing, keep an open mind, ask a lot of open-ended questions, not yes and no's, but open-minded questions so you can really get a sense. Validate assumptions and different conditions. So if you have something that's occurring 7 days a week, 24 hours a day, you may need to do some daytime, some weekend evenings to make sure you're getting the true picture. And that actual data, quantitative and qualitative. And of course, you're going to be respectful of those you're observing in a home situation, a clinic situation, in the waiting room, etc. So I hope this is helpful. Okay, next. Now, no, I said, wow, this looks crazy. This is a shot of what happens after you get all your information from Gembas. And this is what you might see with a value stream map. You might not get a value stream map. You may get a process map. But this is just to show you that this is observations from start to finish. It also includes time. You know, time is also a key data element. We always start with the client, thinking about the patient all along. But you're going to bring your observations with you to the Chicago meeting, and we're going to have some fun activities to do with that. So again, if you're think about it with your team, what you want to observe. It does not have to be a huge process, okay? What are you going to observe? What's needed to be observed? And then get together and discuss how you're going to do it, who's going to be participating, when you're going to start and stop it, and when you get back together to share that information.
And I just want to emphasize that, you know, we want you to observe before the on-site, but you do not need to map for the on-site. We'll be doing that with you in Chicago. So don't let this slide overwhelm.
Yeah, it kind of can be intimidating, I guess. Like, oh, yeah, just have the data with you.
And if you have any questions, just reach out to your coach and we can help walk you through that.
Any questions before we go on to one more key element regarding your assignment? Okay. All right, so next we have a storyboard assignment. I know some of you probably been in other collaboratives where you've had to do a storyboard. They're so helpful for all of us to get to know each other and for you to even get to know your own team. So this is one our partner Sherry put together for us. And as you can see, it includes our vision and what our vision for our team is and our approach to that work and our title and what things we were proud about. We showed pictures in here. You can see our wonderful team there. We were having a Hawaiian send-off for our executive director going out there. So, you know, we had some fun pictures in there and our contact information and things that we're doing. What are we participating and working on? So it's a snapshot that tells you about population health improvement partners. You could look at this and pretty easily figure out what we're all about. So you're going to be creating something similar to this to bring on Sunday. And we're going to have everything you need for that as far as the trifold boards and the push pins and all that stuff. All you need to do is create it. We're going to have a template for you, and you can put it in PowerPoint and then just print those off and bring them with you. And I'm telling you, it's a lot of fun. Get as creative as you can. And like I said, the template walks you through everything that you need to address. So you're going to have things like a condensed aim. You know, we know what our overall global aim is for this collaborative. Maybe you have more of a condensed one. Your team members, and you may, you know, I know some of you have really huge teams that are as far as your advisory, but who's your, you know, that's fine, but also your core team. Family engagement strategies, very important there. Things you're most proud of to date. Definitely want to hear about that. Public service announcement. So what would you say if you had 20 seconds or a 30-second ad on the radio or TV? What would you say about your team and what you're doing? Any materials? I know a lot of you are already starting to create things that you want to test soon. Go ahead and bring those with us too. You may not be able to screenshot them and put them on your PowerPoint, but if you can, that's great. But if not, just bring hard copies and we'll put them beside your poster board. And then you're going to have a section on there where you can get feedback from other teams. Maybe you have questions for some other team that may be working on X, Y, or Z. So you're going to have an area where people can leave comments. So you'll get to go home with all this good advice and ideas for your board, and then you also will be able to provide to others as well. So again, that's going to be a handout for you. And then, you know, so you have till that Sunday when we get together that evening to do our learning and sharing time.
Mm-hmm. And like Mary mentioned, you guys just need to bring the printout of what you want to put on your poster board. We'll have the poster boards for you, tape, push pens, all the things you need to assemble it there. Yeah,
it's hard to put a big poster board on a plane. So
although it would be entertaining to see everyone try, we decided that would not be appreciated.
You don't have to do like a professional poster either, so just keep it simple. All right, so Bethlyn says that we can be creative, or that's what Meg said, being creative, have fun, you know, but we can also put the materials and post them to the box as well. So we want to use what we have. Will this PowerPoint be shared with us after the call? I believe so, yes.
We will definitely share the PowerPoint, and we'll also share that template that Mary referenced in case you want to use that to develop your storyboard.
Oh, yeah, it's very helpful to have that. All right, so I think, unless you have any more, oh, wow, here we go. Some more attachments showing up. If you have any more questions, I want to give Bethlyn and Meg a few moments to do the wrap up and next steps, but feel free to keep interjecting questions that you may have, and we're monitoring the chat box.
Great. Thank you, Carrie and Mary. We really appreciate it. And thank you to everyone for being a part of a lively discussion and very practical, really bringing it down to the level of how this could be useful as to your teams. So Carrie, do you mind moving to the next slide? I do want to mention before I get into this that Meg just posted again the webinar, but some people may have trouble downloading it. It's a large file, and we are going to post it onto our website, and it will then, and we'll do that as a PDF so that you'll be able to, it'll be a smaller file. As you as we've been talking about, we're asking you to go to the Gemba with your observations, and that will help with doing the mapping at Chicago. Develop your team storyboard, as the template was provided at the top of the chat and peppered throughout. Meg also put it in, and we'll also provide it as a follow-up. Meg, please feel free to interject anytime. Oh, and let me just start my video so you can see me while I'm doing this portion too. Great. So, and you'll want to, of course, continue doing this work within the context of your meetings and use your coaching calls to help kind of work this through. And as we've mentioned in the past, we kind of tried to give you a heads up a couple times to try to schedule some extra time. We know that can be really difficult. So we appreciate your doing the best you can.
I'm sorry to interrupt, but you're breaking up a little bit. Would you mind repeating what you just said?
Oh, you just broke up too. Sure.
Sorry.
Okay. So we know that it takes no audio. Let me see. Yeah, I'm not sure what to do, people, because
maybe one of the others of us can talk.
We can hear you,
you're breaking
Bethany.
up as well. It seems like it's an issue. Meg, do you want to try talking and see if you're able to talk without breaking up?
Why don't we turn the floor back over to our friends at Population Improvement Partners, because I think there are some questions for them in the chat with regard to the storyboard. And Bethany, if you want to hang up and try ringing back in. If you can't get back in, I'll go ahead and do next steps on the next slide, okay?
Yeah, you were just breaking up too, so I'm not sure what's going on with the audio, but maybe if we give it back to Carrie and we turn ourselves off.
That sounds great.
Sure. So I do see some questions in the chat box here around, is the template for the storyboard electronic via PowerPoint? Yes, we are going to send you all a template that is in PowerPoint, and you can use that template to develop the information for the storyboard if you like. We are going to ask you to actually print out those slides if you use that template for your storyboard information, because we're going to have one of those trifold poster boards for you at the Learning Collaborative meeting, and we're going to ask you guys actually to pin your information on that storyboard. So we can have that available during the social that we're going to have Sunday night for other teams to see. And like Mary mentioned, we'll have sort of an area where you guys can leave each other notes and comments to help with that sharing piece as well. So if that doesn't make sense, let me know. I'm happy to clarify further. So in addition to the storyboard and actually going to the Gemba and doing your observation, we of course want you to continue meeting with your team and having those coach calls, and do think through if you're going to need to schedule an extra team meeting to fully prepare not only for the Gemba but also for that in-person meeting in October. So just make sure that you think through the logistics for that and get that on everyone's calendars. And then as follow up to the webinar, we do want you all to be thinking through your top 3 successes, your top 3 challenges, and your top 3 goals coming out of the in-person meeting. And I believe that, Bethany, you may have sent an email about that, but I'm not sure if there's a specific way you want teams to provide that information. Was it included in the state's update? She's going to send a Survey Monkey. Perfect. So a Survey Monkey will be coming out with that information following the webinar. Okay. So I'm happy to walk through this if you all want me to, or if you guys want to jump on and take this slide, that's fine as well. Just let me know.
I think that the problem was that there were too many of us that, so if we can mute you as well, Carrie, and then we'll see. So if anyone notices that I'm not clear, all right, cool. I think that's what it was, but if all the host mics were on, then we seem to be having trouble with that. Okay, so Meg, you can jump in whenever you want to, and I'll just mute myself for a minute. So we are having a special session on introducing the state team QI measures to everyone, and this has been an ongoing process to get it done as much, and with a very collaborative process. So We are going to record that. We understand that everyone might not be able to make time on such short notice, but whoever can be there, we encourage you to be a part of that conversation just to get the introduction, and then we'll have a follow-up office hour time with Meg. I'm going to take this Zoom doodle poll and I'm putting it in the chat box so that you are able to tell us when is generally good for you to have open office hours. Meg will have every month, she will have open office hours. So that doodle poll will be for generally when is good. And then we are going to actually schedule open office hours for the week, about the week after the webinar, to actually answer anyone's specific questions. So the full hour will be taken up with that special session to discuss the QI measures. Anything else you want to add, Meg? Yes. Office hours, she said, are for anyone once a month for an hour. And that means if you would like to ask something and you want to specifically take some time, you could schedule it ahead, or it can be drop-in as well. And so we'd let you know whether or not it's just if there's time that's all open, or if some of it's scheduled out. So people are welcome to try to schedule ahead too. Allison needs to jump off. Yes, well, in the follow-up email, we will be sending all of the poll information as well, because we also have an evaluation survey. So anyone that needs to jump off. Thank you for your state team updates. Reminded that they're the last Friday of every month. Our next newsletter is coming out. If you have any other questions, put in the chat box and we'll respond via email. And we'll go to the next slide. And this just tells you the upcoming events. You will get this slide, and I'll also make sure this is in the follow-up email, and it's always in the e-newsletter. So I'm not going to go over this right now. So let's go to the next slide. If anyone wants to do the webinar that's coming up in just a few days, you just want to make sure that you knew about it from the Field Hacker Foundation. And next slide. The evaluation, I'm going to also put that into the chat box. And please make sure to contact us if you have any other questions. And let me just put that in the chat box. And Mary wanted to say, keep on keeping on, teams. We appreciate all you're doing for our kids and families. So that's it. If anyone has any other questions, please put them in the chat box. I'm also going to put the webinar evaluation in there right now. And once you've got that information, you're all welcome to go. Thank you so much. We look forward to seeing all of you at the in-person that are able to make it. And thank you again for this great discussion.
Thank you, everyone.
All right, let me put this in. There we go. So that's for the evaluation. Please, it just takes a moment to fill out, and it's very helpful to us. Thank you, everybody.
Bye, everyone.
Thank you all. Take care.